Good morning, dear students. One topic which we have dealt already is gout or gouty arthritis, which was a type of arthritis. Now, the next topic which we will be dealing in autoimmune diseases is rheumatoid arthritis. So, rheumatoid arthritis is also a type of arthritis and it is also an important topic like gout. And this topic also you might study again in musculoskeletal disorder. Now, rheumatoid arthritis is a condition usually there here the patient will be having, it is a chronic condition, and at the same time it is an autoimmune disease where there is destruction of one's own immunity, and along with that it is a systemic disorder. We tell that it is a systemic disorder because it affects many organs, or it usually affects many systems. Okay, that is entire body will be affected, not only your bones or joints is affected here, the entire body will be affected. So it is referred as a systemic disorder also. And it is usually results in symmetrical inflammation of the synovial joints. That is, symmetrical inflammation means the same joints will be affected. If it is knee joint means both the knee joints may be affected. If it elbow joint is affected, both elbows will be affected. Okay, so symmetrical inflammation of the synovial joints will be there with the period of remission and exacerbation. Now remission means it usually repeats, okay, recurrent. Okay, once it happens again and again, recurrency will be there. Usually it is not curable like, but you can get some repeated attacks. Exacerbation means it refers to increase in severity. Okay, suddenly rheumatoid arthritis may become very severe, like severe attacks may be there. Okay, so that is a definition of rheumatoid arthritis. It is referred as RA. So rheumatoid arthritis is a chronic condition because it is present for a longer duration of time. It is a systemic condition because it affects almost all the parts of the body. It is an autoimmune disease where there is self-destruction of one's own immunity here. And usually here in rheumatoid arthritis, there is presence of an auto-antibody which is called as rheumatoid factor. Okay, so rheumatoid factor is present in rheumatoid arthritis only. You can detect it in blood investigation. And usually it usually results in symmetrical inflammation of the synovial joints and with periods of remission and exacerbation. Remission means recurrency, exacerbation means acute attacks will be there. Now, as I have told, rheumatoid arthritis not only results in articular symptoms. Articular symptoms means related to the bones and joints. It also results in extra-articular symptoms. Extra-articular symptoms means what? Other than the bones and joints, it is going to affect the other parts of the body, like maybe skin is affected, lungs are affected, or subcutaneous nodules or blood vessels will be affected. Okay, that is called vasculitis, and it may also affect your pericardium. So those are referred as extra articular symptoms, means other than the joints it will affect the other parts of the body. And already I mentioned in the definition itself, rheumatoid arthritis involves symmetrical involvement of the joints. Means symmetrical joints are involved. Maybe the elbow joints are involved, wrist joint is involved. MCP joint means metacarpophalangeal joints. PIP, which means proximal interphalangeal joints. Okay, distal interphalangeal joints. These joints are commonly affected. Okay. Next is moving on to etiology. Now this PIP, DIP and MCP joints are actually of that of the finger. Okay. So incidence, we have usually seen that rheumatoid arthritis increases with age, and commonly it is seen that women are more affected than men. Especially after menopause, rheumatoid arthritis is very common among women. And the peak is usually it is seen in between the age group of 30 to 50 years. Next is moving on to the causes of rheumatoid arthritis. Now, rheumatoid arthritis is idiopathic in nature. It is because of an unknown etiology. It is multifactorial, that is, many factors are responsible for rheumatoid arthritis. Next is autoimmunity. Already I have told it is because of excess autoantibodies, that is, rheumatoid factor will be present in rheumatoid arthritis. It could be genetic predisposition, family history may be responsible. Certain infectious agents like bacteria, fungi, viruses like Epstein-Barr virus, cytomegalovirus, herpes virus, and rubella virus may also result in rheumatoid arthritis. Some risk factors are also there. Now, exposure to environmental factors like pollutants, chemicals or toxins, certain allergies, cigarette smoke, then women are more prone to get rheumatoid arthritis because of hormonal changes and after the menopause. Sometimes trauma or injuries to the bones or joints may also result in rheumatoid arthritis. And next is excess consumption of tobacco. Now next we will move on to the pathophysiology of rheumatoid arthritis. Now pathophysiology is only essential for BScs. GNMs don't require pathophysiology. Now, due to etiological factors, we know what is the etiology already, isn't it? Like environmental factors or because of presence of autoantibodies or because of trauma or injury. In all these etiologies, it will initiate the activation of T cells or neutrophils. Okay, there is initiation of rheumatoid arthritis by activation of T cells and neutrophils. So because of the initiation of these inflammatory mediators, what happens is there is production of autoantibody. Okay, the autoantibody that is produced here is RF, that is rheumatoid factor. So remember that RF is only present in rheumatoid arthritis. It is an autoantibody, okay, which results in autoimmunity. So this RF factor will start to increase. So once there is increased production of RF, what happens is the immune complex deposits on the synovial membrane or the articular cartilage. Okay, so this RF will start to deposit on the articular cartilage or the synovial membrane. So next what happens is more and more inflammatory mediators will be released, like your monocytes, lymphocytes, leukocytes, all this will be released. Because of this release of these inflammatory mediators, what happens is there will be inflammation of the synovial joints, tendons, ligaments and cartilage. When there is swelling of synovial joints, tendons, ligaments, the symptoms that is seen is edema, swelling, okay, especially of the synovial joint. So these are the symptoms that is seen. Along with that, because of the inflammation of the joints and tendons, there will be granulation tissue. Okay, this granulation tissue will form over the articular cartilage. This granulation tissue is called as pannus formation. So when the pannus is formed, it will result in destruction of the articular cartilage or the synovial membrane. So complete destruction of articular cartilage will happen. Because of that, usually there will be erosion of the bones, destruction of the bones, contractures will occur and synovial inflammation will happen. So this is the pathophysiology. Okay. So pannus formation means there is abnormal thickened synovial tissue or granulation tissue over the articular cartilage. That is called as pannus formation. Okay, so next we will move on to the clinical manifestations. So already I told under the clinical manifestations of rheumatoid arthritis, two type of symptoms will be seen. One is articular symptoms and one is extra-articular symptoms. Articular symptoms are restricted to the joints or to the bones, while extra-articular means it is affecting all the other organs. Okay, so we'll see the clinical manifestations. Usually the patient will be having weakness of the body, fatigue, anorexia, loss of appetite. Weight loss is seen. Patient usually complains of joint pain and joint stiffness. Now joint pain and joint stiffness is usually seen in the early morning. When they get up in the early morning, There will be sudden worsening of the joint pain. Okay, and slowly sometimes it is seen that this joint pain and joint stiffness is also increased during infection or during stress and all. Now the remaining symptoms that is seen are polyarthritis. Polyarthritis is the inflammation of many joints, okay, or swelling of many joints. And already I told there is symmetrical pattern of joints involvement. Symmetrical pattern in the sense both the joints are involved. Maybe the same elbow joints, wrist joints are involved. Along with that, the person will be having synovitis, inflammation of the synovial joint, and the joints will be warm to touch. Inflammation or swelling will be there, and when you're touching, there is pain. That is called as tenderness. And most of the time, because of excess swelling and pain, there will be limited range of motion. They may not be able to move the joints. The common joints that is involved in rheumatoid arthritis are hands, wrist, shoulder, elbows, feet are involved, knee is involved, hip and even cervical spine may be involved. So here you can see that in early stages how the condition is. After 5 years what happens, and after 15 years you can also see the nodules here. Subcutaneous nodules are being seen. Okay, so the subcutaneous nodules are characteristic feature of rheumatoid arthritis. Some other characteristic features are there of rheumatoid arthritis. These are the important symptoms. First one is swan neck deformity. Now as you can see there in the picture here, swan neck deformity is the hyperextension of the proximal interphalangeal joints. Okay, swan neck deformity is the hyperextension of proximal interphalangeal joint and flexion of the DIP joint, that is a distal interphalangeal joint. Here you can see here. Okay, so that is swan neck deformity. In simple terms, you can tell that it is a flexion of the base of the finger and extension of the middle joint. Okay, swan neck deformity is a flexion of the base of the finger and extension of the middle joint. Next one is boutonniere deformity. Boutonniere deformity is the flexion of proximal interphalangeal joint and extension of DIP joint, that is distal interphalangeal joint. Okay, it is just the opposite of the swan neck deformity. Okay, you can see boutonniere deformity. Okay, so boutonniere deformity here also you can see it is a flexion of PIP and extension of the DIP. This is the DIP. Next one is complete damage of the synovial membrane can be there. Next, atrophy of muscles can occur. Next, ulnar deformity can occur. Ulnar deformity is nothing but ulnar deviation of the fingers. Here you can see the deviation of the fingers here, that is deviation of MCP joint. This is the MCP joint. Okay, so you can see that there is ulnar deviation, that is called ulnar deformity. Sometimes it is also called zigzag deformity. Next one is hallus valgus. Now hallus valgus is a deviation of the greater toe. Okay, that is called hallus valgus. Here you can see here in the figure clearly. Okay, that is hallus valgus, deviation of the greater toe. So these are the main clinical features. Along with that, already I mentioned about the subcutaneous nodules. Okay, so commonly nodules are seen here. Deposition will be there, that is referred as subcutaneous nodules. Okay, so the main other features of rheumatoid arthritis is swan neck deformity, where there is flexion of the DIP and extension of PIP. Boutonniere deformity is just the opposite, flexion of PIP and extension of DIP. Ulnar deformity is zigzag deformity of the fingers. Hallus valgus is the deviation of the greater toe. Next we will see some extra articular symptoms, that is not related to bones and joints, but here the clinical manifestations are seen in other systems, let is skin, lungs are affected, heart may be affected, okay, blood system may be affected. So pleuritis, commonly there can be inflammation of the pleura. Pleural effusion is also very common. Pneumonitis can occur. Pericarditis is also very common. Cardiac failure or heart failure where there is inability of the heart to pump. Osteoporosis happens. Peripheral neuropathy. Usually in peripheral neuropathy, the person will be having numbness of the hands and feet, muscle weakness, rheumatoid nodules. Already I have shown the picture, subcutaneous nodules. Anemia may be there, decrease in HB or RBC. Along with that, purpura is seen. Vasculitis, that is inflammation of the blood vessels, is also seen. This is subcutaneous or rheumatoid nodules, pleuritis, purpura and vasculitis. How to diagnose rheumatoid arthritis? History collection can be done. Physical examination of all the deformities like swan neck deformity, bottineau deformity, ulnar deviation, hallux valgus can be done. MRI and CT scan is commonly done for the patients. Blood investigations is done. Commonly in rheumatoid arthritis, you will see the autoantibodies RF or rheumatoid factor. Next, anti-nuclear antibodies are also detected. Now, ANA is positive means it will show that person is having autoimmunity. C-reactive protein is positive, especially when there is inflammation and swelling. Complete blood count can be done. Urine examination or urine analysis is done. X-rays can be done. Along with that, synovial fluid analysis will be seen. Normally it is transparent, but here it can become milky or cloudy in appearance. Bone scanning is also done here. Now we have got both pharmacological and non-pharmacological management of rheumatoid arthritis. First we will see non-pharmacological management. So first of all, we have to assure bed rest to the person whenever they are in acute phase. Okay. Along with that, physiotherapy is given or physical therapy is given to reduce the muscle spasms. Hot fomentations can be done to reduce the pain. Infrared therapy also can be used to reduce the pain and inflammation. Moderate to mild exercises are advised by the physiotherapist to increase the strengthening of the muscles and for joint mobility. It will prevent the joint stiffness. Okay, so most of the time isometric exercises will increase the muscle power. Good body mechanics is advised. Good body alignment is also advised and correct posture is necessary. Next, acupuncture, that is use of needles to reduce the pain. Yoga therapy, meditation. Avoiding stress is very essential because during the time of emotional stress, usually the attacks of rheumatoid arthritis is seen. Then alternative schedule the periods of rest along with the activity. So ask the family members to assist the patient. Along with that, the patient may need some assistive devices like splints may be necessary, canes or walkers may be necessary, and usually Western raised toilet seats are advised other than the Indian type. Traction is also advised for the person. Some other non-pharmacological treatment include diet, we will see it in the next slide, exercise, acupuncture. Certain herbal medications are also advised. Massage therapy, prayer, hypnosis, these are all non-pharmacological management. So under nutrition, it is advised that patients with rheumatoid arthritis should take adequate amount of calcium, vitamin D, B6, B12, vitamin E, calcium, magnesium, zinc and selenium. So ask the patient to take more of green leafy vegetables, fruits, okay, then grains, pulses, fish and seafood is essential. Ask them to reduce the intake of alcohol or quit smoking. Then exercises are necessary, especially for the patients who are obese. Tell the person to perform at least exercises for 4 times a week, at least for half an hour. Walking, that is brisk walking, light jogging, aerobics, cycling, stretching exercises, yoga and tai chi are effective. Next is pharmacological management or medical management. This is also very, very important. To reduce the pain, we can give analgesics or NSAID, non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, naproxen and indomethacin. They will reduce the inflammation and pain. Corticosteroids are also advised to reduce the swelling and inflammation like prednisone, dexamethasone. The main drugs that we give here is disease modifying anti-rheumatic drugs or anti-rheumatoid drugs. They reduce the pain and swelling. Example are gold, D-penicillamine and methotrexate. And particularly to suppress the autoimmunity, we give interleukins, which are biologic response modifiers. And to reduce autoimmunity, we give immunosuppressive drugs. Example is azathioprine and cyclosporin. They will reduce the autoimmunity or suppress the immunity. Now, surgical management is commonly done only when person is having acute attacks and it is not controlled by medications. Commonly, we don't go for surgery. Synovectomy, arthrodesis and plasmapheresis. Plasmapheresis is not a surgery. It is just a management. Synovectomy means you are removing the synovial membrane. Okay. It is only done for temporary relief. Orthodesis is a method where you are doing the fusion of the joints for stabilizing the joints. And plasmapheresis is done for treating autoimmunity. Okay, plasmapheresis means plasma exchange. Okay, it is similar to that of like that of dialysis, but here what they will do is once the blood is removed from the patient, plasma will be removed, okay, or discarded, and the remaining blood will go back to the patient because plasma will have the auto antibodies. Okay, so you are discarding that plasma, okay, and the remaining blood will be given back to the patient. And once the plasma is discarded, you will have to replace back by giving dextran or albumin to the patient. Okay, that is called plasmapheresis. Only it is done for patients with autoimmunity. Nursing diagnosis: chronic pain related to inflammation of joints, fatigue related to joint pain, disturbed body image related to deformity. So this is regarding the topic rheumatoid arthritis, a very important topic.